A stroke occurs when blood flow to a part of the brain is interrupted, depriving brain cells of oxygen and nutrients. This can be caused by a blocked artery, known as an ischemic stroke, or the rupture of a blood vessel, referred to as a hemorrhagic stroke. The consequences vary widely depending on the area of the brain affected and the severity of the damage. Prompt medical attention is crucial to minimize brain damage and begin rehabilitation. Rehabilitation helps stroke survivors regain lost function and improve their quality of life. Acupuncture, a core component of traditional Chinese medicine, aims to restore balance by stimulating specific acupoints. It promotes blood circulation, reduces inflammation, and facilitates healing in the brain. Speech aphasia, a common consequence of stroke, affects an individual's ability to communicate. It can manifest as difficulty speaking, understanding language, reading, or writing. Acupuncture can play a role in improving speech aphasia by stimulating specific points related to speech and language centers in the brain. Points commonly used for speech aphasia include Li4, located on the hand between the thumb and index finger, and St4, on the face below the pupil. These points are believed to influence the flow of qi and blood to the brain regions responsible for speech and language processing. Acupuncture treatments for aphasia typically involve inserting thin needles into these and other relevant acupoints. The needles may be left in place for a period, often accompanied by gentle manipulation or electrical stimulation to enhance their effect. The frequency and duration of acupuncture treatments vary depending on the individual's condition and response. Studies have shown that acupuncture can improve language fluency, comprehension, and overall communication abilities in stroke patients with aphasia. By promoting blood circulation and stimulating nerve regeneration in the affected brain areas, acupuncture can help restore lost speech function and enhance communication. Visual impairments, such as blurred vision, double vision, or visual field deficits, can also occur after a stroke. Acupuncture may help improve vision by stimulating acupoints around the eyes and on the head that are connected to the visual cortex. BL1, located near the inner corner of the eye, and GB1, situated on the outer corner of the eye, are commonly used acupoints for vision problems. These points are thought to enhance blood flow and nerve function in the visual pathways, potentially leading to improved vision. Acupuncture treatments for vision recovery often involve a combination of local points around the eyes and distal points on the limbs. The selection of points is tailored to the specific visual deficit and the individual's overall condition. Research suggests that acupuncture can be beneficial in improving visual acuity, expanding visual fields, and reducing visual distortions in stroke patients. By stimulating the visual cortex and promoting nerve regeneration, acupuncture can contribute to restoring lost vision and improving visual function. Sensory perception, including touch, temperature, and proprioception, which is the awareness of body position, can be impaired after a stroke. Acupuncture can help improve sensory function by stimulating acupoints along the meridians that govern sensory pathways. Points like PC6, located on the inner wrist, and SP6 on the inner leg, are often used to address sensory deficits. These points are believed to regulate the flow of qi and blood in the meridians that connect to the sensory cortex. Acupuncture treatments for sensory improvement involve stimulating specific points related to the affected sensory modalities. The acupuncturist may also use techniques like electroacupuncture, where a small electrical current is passed through the needles to enhance the stimulation. Studies have indicated that acupuncture can enhance tactile sensitivity, temperature discrimination, and proprioceptive awareness in stroke patients. By modulating nerve activity and promoting sensory pathway recovery, acupuncture can contribute to regaining lost sensory function and improving overall sensory perception. Section 5. Alleviating post-stroke limb pain with acupuncture. Pain in the affected limbs is a common and often debilitating consequence of stroke. This pain can arise from muscle spasticity, nerve damage, or joint stiffness. Acupuncture can provide effective pain relief by stimulating acupoints that release endorphins, the body's natural painkillers. Points like Li4, Hegu, St36, Zusanli, and GB34, Yanglingquan, are frequently used for pain management. These points are known to have analgesic effects and can help reduce pain intensity and improve mobility. Acupuncture treatments for post-stroke limb pain typically involve inserting needles into the affected limbs and other relevant acupoints. The needles may be retained for a period, and techniques like moxibustion, the application of heat to specific acupoints, may be used to enhance pain relief. Research has consistently demonstrated the effectiveness of acupuncture in reducing post-stroke pain. By modulating pain pathways and promoting the release of endorphins, acupuncture can provide significant pain relief, improve quality of life, and facilitate participation in rehabilitation activities. Section 6. Scalp acupuncture, a holistic approach to stroke recovery. Scalp acupuncture is a specialized form of acupuncture that involves stimulating specific areas on the scalp that correspond to different brain regions. This technique is believed to directly influence brain function and promote recovery after stroke. Different scalp acupuncture areas are used to target specific motor, sensory, or speech functions. The needles are inserted superficially into the scalp and may be stimulated manually or with electrical stimulation. Scalp acupuncture is often used in conjunction with body acupuncture to provide a comprehensive approach to stroke rehabilitation. It is believed to enhance the effects of body acupuncture and promote more rapid recovery. Studies have shown that scalp acupuncture can improve motor function, sensory perception, and speech abilities in stroke patients. By directly stimulating the brain, scalp acupuncture can facilitate neuroplasticity, the brain's ability to reorganize itself after injury, and promote functional recovery. Section 7. Xi Nao Kai Qiao, specialized acupuncture for stroke. Xi Nao Kai Qiao is a specialized acupuncture technique specifically developed for stroke rehabilitation. It involves stimulating a specific set of acupoints on the head and limbs that are believed to open the orifices of the brain and promote the flow of qi and blood. The acupoints used in Xi Nao Kai Qiao are selected based on the individual's specific symptoms and the location of the stroke. The needles are typically inserted and manipulated to achieve a strong stimulation. Xi Nao Kai Qiao is often used in combination with other acupuncture techniques and rehabilitation therapies. It is believed to be particularly effective in improving motor function and reducing spasticity. Section 8. Research and evidence supporting acupuncture for stroke. A growing body of research supports the effectiveness of acupuncture in stroke rehabilitation. Numerous studies have shown that acupuncture can improve motor function, sensory perception, speech, vision, and reduce pain in stroke patients. These studies have employed various research designs, including randomized controlled trials, to evaluate the efficacy of acupuncture. The results have consistently demonstrated the beneficial effects of acupuncture in promoting stroke recovery. Section 9. Integrating acupuncture into stroke rehabilitation. Acupuncture can be integrated into a comprehensive stroke rehabilitation program alongside conventional therapies. It can complement and enhance the effects of physical therapy, occupational therapy, and speech therapy. By addressing multiple aspects of stroke recovery, including motor function, sensory perception, speech, vision, and pain management, acupuncture can contribute to a more holistic and effective rehabilitation approach. Section 10. Conclusion. Acupuncture's promise in stroke recovery. Acupuncture offers a promising complementary therapy for stroke rehabilitation. Its ability to improve motor function, sensory perception, speech, vision, and alleviate pain makes it a valuable tool in promoting stroke recovery and enhancing quality of life for stroke survivors. While further research is ongoing, the existing evidence suggests that acupuncture can play a significant role in optimizing stroke rehabilitation outcomes and helping individuals regain lost function and independence. Michael Woodworth at Makari Wellness has been specializing in neurological conditions for over 10 years and has over 20 years of clinical experience. He has pursued extensive training with specialists in these systems of treatment and offers his expertise in San Diego, California.